All right, we're live with the first presentation, and oops. Okay. We're live with the first presentation of the day for the fifth and final day of Swarm's AI Expo. We're going to be diving into AI in cybersecurity, risk mitigation, and healthcare management with my very dear friend Shaista Hussain. Um, Shaista is an accomplished AI leader and machine learning engineer leader with a distinguished career in machine learning operations. Cybersecurity operations and every permutation of that. Um, she has been an academic and innovator, leading laboratories specializing in the development of AI systems, and has a deep passion for creating cutting edge algorithms and responsible AI models. Currently, she's spearheading the developments of SafeCheck, an organization dedicated to championing responsible AI across the world. So with that, Shai, the floor is yours.
Thank you, Joaquin. Always a pleasure to be here, and always exciting to be a part of another Swarm AI community event. We'll get kick started. We're focusing today on cybersecurity and healthcare AI. This is a field that I guess applies mostly to people who are in the healthcare industry, from administrators to healthcare deliverers. It also applies to anyone who is a patient in the healthcare industry. So really, it applies to everybody in the world wants to make sure that their healthcare is headed in a direction that is safe and trustworthy. Uh, this is myself. Thank you. My LinkedIn is here, Dr. Shai AI Pathology. Happy to connect. And so the way I'll be doing this is I'll cover 10 sort of main domain segments within healthcare AI security. And for each one, I'll give you a small definition, an example, and then some mitigations. So these are the mitigations we'll go through. It won't take too long, but I'll try to give you a nice overview of what are the things that should be considered in the process. Starting with cyber attacks. It's a word that's thrown around a lot. It's not specific to healthcare, but within the AI world, adversarial attacks are rapidly increasing. There's a surge in the creative ways that bad actors are exploiting AI solutions. And that's a huge risk because, as it is, the world of AI is relatively new given the newer technologies. And the newer sort of applications of AI are relatively new. There are other things that could be considered under cyber attacks: evasion, data poisoning, privacy issues, phishing, which is like through emails. There are social engineering tactics. Deep fakes is another one, and one of the types of deep fakes we'll talk about in another example. Malware abuse, whether it be cyber abuse, bullying, or abuse of systems, and then chatbot phishing, which is a newer sort of segment within the cyber attacks. So the example I'll give here is using convolutional neural networks in pathology, which is something that I was doing, especially in my early days, where researchers, and this is all the examples are real. So in this example, there were researchers that were able to manipulate input data. Input data is the data that you're training your machine on to then be able to make predictions later. So researchers were able to manipulate this input data in a way that you couldn't identify with your eye. So in whole slide images, you get this tissue image that's very magnified within the body. And they could make slight changes that a normal human eye wouldn't see, but it would cause the machine to misclassify what something is. So where something may have been cancer positive, it's now detecting that it didn't meet the requirements and it's cancer negative. That could be used and vice versa also for insurance fraud or to target certain patients if an attack or a breach happens within a system. And the ideal mitigation for that is that all healthcare stakeholders, anybody working in the healthcare space, should be supporting the development of the policies and protocols towards practicing healthy or cyber hygiene, they call it. And this is something that should be done by all employees. And there should also be an incident response plan, which is basically just a checklist of things to do if and when anybody detects that there's something fishy happening. I've been putting the SafeCheck logo throughout this just to let you know where and when SafeCheck can offer services to mitigate. So The second one we'll move on to is data privacy. And I guess this applies to more patients as well in terms of an area of concern. But suffice to say that in 2022, the data privacy attacks on the healthcare industry specifically worldwide came to about $7 million. And that was just for 20% of the data attacks that happened. And that's what was recorded. This year alone, this January, the US Department of Health and Human Services reported nearly 1 million healthcare record breaches. 1 million. If you put that in context, that's a massive number of patient files that were revealed. You've got 4 cyber attacks that were specific to AI systems, and about 3 million individuals' data was compromised. Data which includes their credit cards, their healthcare conditions, their social security or their insurance information. This July, there's a specific example that happened. There was the Move It file transfer tool, which is basically something like when you're sending a large file from one person to another. So hackers managed to get unauthorized access into this file transfer within a healthcare system. They damaged the entire integrity of the AI system that the hospital or healthcare system was using. They exploited the patient's data. So that means patients' data who they had acquired, they could now hold for ransom. And then obviously the hospital's trust was gone and reputation was damaged. So this specific Move It massive attack affected in total 22 million people. This is just very recently, and more than 400 organizations. How do you manage something like that? Number one, you need a very good data privacy strategy. It means you need a well-educated group, a diverse group of thinkers who are able to come together and write policies and say, this is how we'll maintain our data, this is how we'll protect it, and this is the incident response plan if something were to go wrong. In the process, the security engineers should be, especially in healthcare, constructing firewalls, very specifically strong firewalls when third-party apps are used. So in the modern day, most systems are dependent on 1 or 2 or more APIs. And those APIs are doorways that allow you to use another technology, but they're also doorways where bad actors can come in and take advantage of a situation. So this speaks all to the security architecture of how healthcare systems are designing their security protocol, how often they're doing their risk assessments, again, which is something you could do at SafeCheck, and then also practicing something called ethical hacking. And that's something that doesn't take as much precedence in general in private systems. Oftentimes it happens more in government systems, but private systems should also be engaging in healthy ethical hacking where they have security engineers of their own that attempt to breach their own security system to see if they can isolate or identify vulnerabilities. Next one is data bias and inequality. This is an issue not necessarily just for hackers or security, but in terms of healthcare specifically, when you're depending on AI systems for diagnostics, I'll give you a very simple example here, like X-rays, when they were trying to differentiate between if somebody presented with COVID a few years ago, or if it was just a lung infection, or it was a lung cancer. And so people were depending at that time on humans to identify what a diagnosis was based on an X-ray. At that time, early AI programs were also being used using computer vision to identify specific features that are unique to lung cancer or pneumonia or COVID. In 2020, in China, there were 21 COVID patients who were misdiagnosed as having lung cancer, so that where the infection bolus was, the machine learning system picked it up as a cancer nodule. And that was because the training data had all of the training data they had previous to that moment did not have something called COVID. So the closest thing that the machine learning system was able to do was say, there's a bolus here, a little ball, and that ball looks like, based on our training data, some sort of cancer. So these people were all told they had cancer where they actually had COVID. And then that speaks to the quality of the training data and having the right team to source the most appropriate training data for a given system. And it also requires that you regularly update that system. So in the case of this hospital, they may have had a great pneumonia data set and they may have had a great lung cancer data set, and the machine might have been very specific to picking those things up, but because they hadn't updated their data set regularly, it wasn't able to pick up COVID. And in this case, you want to definitely update your system, your training data. You want to make sure that there's human oversight, and that means at the end of every machine learning or AI system prediction, in a hospital care setting, there should be a human that says, I agree or I disagree with this diagnosis, and have the final control and say over that diagnosis. The next thing is something called cryptographic attacks. This sounds really fancy and dystopic for the future, and it kind of is. But I mentioned we would talk about the deep fakes. The example I'll give here to explain what cryptographic attacks are is when you're able to impersonate somebody else. So there in 2019, there's an AI-powered voice tech that was used, an app, and this is a real story. You can Google it and check it out. So somebody used this AI app, which most people have access to now, to impersonate their CEO. And their CEO then made the fake CEO, made a call into their hospital and said, I want an immediate transfer of 220,000 euros immediately. And because it sounded so much like the CEO, the transfer was made. And so this is an example of how people are bypassing authorization systems, where typically you would need some form of identity, a confirmation, a verification of that identity, a secret passcode, or other protocols where you could mitigate that risk. But it wasn't done. And so this poses a risk really in terms of in the healthcare setting to the sharing of information or even money exchange. So it's a pretty scary one. Another one is transparency gaps. And what I mean here is transparency within AI systems is the ability for a machine learning model to be able to say how they came up with a prediction or an output. And you want to be able to have that transparency so as not to blindly depend on a diagnosis that is made at any given time by a given model. The example I'll give here is in 2018, it was a very famous article that was published in Nature magazine that outlined this incident, that there was an AI skin diagnosis app that a lot of dermatologists were starting to use because it seemed like it was saving them a lot of time. And this model relied on training images. So they had built a training data set saying, this is a mole, this is skin cancer, this is eczema, whatever number of conditions they had identified. But each image that they had taken from within the clinic where they got their training data had a ruler or a coin, like a regular penny or a quarter, to be able to show the size of whatever was in the photo. And all of the photos consistently had this ruler and the coin. So they uploaded this training data expecting that the machine would crop out that coin or that ruler and just focus on the image. It didn't. The machine became dependent on the ruler and the coin to be in each picture. And when it was making predictions, it kept giving erroneous or wrong answers depending on the type of ruler that was showing up. So when a patient would go to the dermatologist and the dermatologist would now take an image of whatever it is on somebody's skin, the machine was unable to make the prediction correctly because there was no ruler or there was no coin. And so the issue with this is if you have training data that hasn't been seen by both a domain specialist, in this case a dermatologist, but also by somebody who's savvy in responsible AI development, you may end up with a brilliant software, a brilliant tool that is unable to detect what it is very much supposed to detect and make unreliable predictions. So again, human oversight in making that final decision in the diagnosis comes into play here. Knowledge graphs also play a huge role in something like this, where knowledge graphs can take different types of data, and then when a machine makes its prediction, somebody is able to go back in the process in the ML ops cycle and understand where the inferences were made, how a decision was contextualized, and what was the causality for a final decision. Hardware and software updates, they're very annoying. We all get them on our laptop, we get them on our phone. Do you want to update your system? And as much as they're annoying, they actually are mandatory in terms of enhancing the security of any system that you're using, especially in the healthcare environment. So you run the risk of, number one, in a healthcare system, I mentioned you're using APIs or third-party processes. If you're not all updating, if not everybody in the cycle is updating their software and their hardware consistently, you may run into software incompatibility issues or downtime, lag time in terms of sending and receiving files. And that the supply chain of security is exactly that each person or each node within that network should be updating consistently. If you don't, you end up with an example like what happened at UCLA now almost 10 years ago. A database was compromised using IoT network access. So in this case, the system there was system incompatibility. Some of the hardware was compatible with the IoT sensors and some was not. The system ended up being hacked and compromised because somebody found a gap in between the compatibility of the systems. The hospital itself compromised the patient data. That was the biggest harm that was done. Secondarily, they incurred a massive $7.5 million fine because they were unable to report to HIPAA what had happened. So they were looking for malware, ransomware, all these other things. And in fact, it was just basically that they hadn't updated their system and somebody found a way to compromise it. In this case, what you want to do is sort of back to that system policies and protocols where you want to have somebody continuously monitoring the function of a system and monitoring the network, the supply chain that's happening to make sure everybody's consistently updating, and patches. If patches are made available by your software solution provider, use them. The patches mean that a security team has found a risk and it's worth fixing. Regulatory compliance. So this is another area that can be almost burdensome for a lot of people. There's HIPAA, there's the GDPR, there's the EU AI Act, there's also different regional sovereign ISO, NIST. There's 1,000,001 of these regulatory compliances. They actually play a very massively important role because when a system or when an industry or a company is up and running and using AI systems, if they're not complying, then they're not necessarily in the know of what the latest risks are. These regulatory bodies are in the know of what the latest risks are, and they update accordingly. If you don't do it, you run, like that last example, the risk of paying penalties. If in a previous example, we talked about how the breaches can affect the reputation and finances of a healthcare system. So the example I'll give here is in 2013, there was a group called Advocate Healthcare. They had a data breach as well that compromised 4 million patients' information. This is all of their personal data. What they found is that their data had not been encrypted, neither at rest nor in transit. And HIPAA had clearly made a statement that said, if you are using this kind of technology, the data must be encrypted both at rest and in transit. Since it wasn't, they incurred a really large fine. But I don't think that a $5.5 million fine is in any way equates to the fact that 4 million patients' credit cards and personal information was made accessible to a bad party. And then how you want to mitigate this is, again, you want regular patch updates and you want compliance audits. And to be ready for those compliance audits, you need to have internal security assessments within your own company prior to going out and saying we're ready for the audit. And the reason for that is twofold. One, you have an internal security posture that you're confident in, and your team might pick up on things that a compliance audit might not. Secondarily, you can run the compliance and then find out that there are things that your team missed or that are within the regulation hadn't been considered. So both an internal security risk assessment, posture check, and third-party compliance. The next example is having humans in the loop. And I brought this up as its own thing. We talked about the importance of human oversight, having control over the final prediction or output from a machine. But in this case, the example I'll give you is there was an AI system that was capturing images of body discharge. And in this case, there was an image of mucus, and the AI system understood the mucus to be a blood clot. Coming from a patient's lung. And then this created a false positive. So by saying a blood clot, they thought that there was a pulmonary embolism, which means like a blood clot that blocks the airways, where in fact it was just mucus that can happen so often to anyone who's experiencing a flu or a cold. And in this case, doctors who were not looking closely enough at both the patient symptoms or at the AI system, that lack of human oversight led to a bad diagnosis. And now with a misdiagnosis, you've got a patient who is already unwell being treated for something that they don't have rather than being treated for what they do have and going home with the extra worry. And so this creates a bad dependency from clinical practitioners who are just saying, I don't need to do anything. The AI is going to tell the people what they have. That's not the case. And so what you want to make sure is that after a model makes any decision, sure or unsure, that there's transparency into how they made it and that you as a human can say, yes, I agree, or no, I don't agree. Team readiness, this speaks to research, preparedness, and the protocols. And that just means that everyone in the healthcare system should be ready to practice cyber hygiene, but also be ready to act upon anything bad that happens as the risks increase. So one of the risks is malware that happens by bad passwords. If you are in a healthcare system and you're not regularly updating your password, this is a huge problem because the pattern of your password could be predicted by malicious actors. Alternatively, you could receive an email, and we've all fallen privy to this. Somebody sends you an email and says, click this link. If you're in a rush, you may not be looking and you click the link. You should be very cautious about what you click. But if you click something that looks relatively safe, the moment you make that click, you open up a doorway for somebody to access an entire system, not just necessarily through your phone. It can connect through your phone, through the Wi-Fi, all the way to the hospital system. And then again, you end up with patient data compromised, reputation loss, etc. This happened in 2021 in San Diego. Healthcare system had received malware. One employee opened a bad email and had no multi-factor authentication set up on their own personal account. The malware, the bad actor, accessed that employee's access to the hospital system and shut down all ambulances so that no ambulances were dispatched. Subsequently, the whole emergency department was shut down. And they saw in a very short period of time, I think it was within 2 hours, 127% increase in patients who were not able to be seen by doctors because the whole system became dependent on electronic services. Doctors only knew there was a patient to be seen when there was an electronic notification. And so the whole system kind of just shut down. And then again, I speak to the mitigations, which is staying up to date with research in terms of what are the latest cyber risks. There's OWASP and there's a number of other systems online that do tell you the top 10 latest risks that are available. Changing passwords, multi-factor authentication can confirm on your laptop and then confirm with the fingerprint or confirm on your phone. And you must train employees on how to become vigilant when it comes to opening emails or what systems are allowed to have ultimate access. The last example we'll give is accountability and liability. And here what we're talking about is all of the players in the entire chain of system that's involved in healthcare AI usage. That means the C-suite, the executors who are making the decision to adopt an AI system, the technical team who are going to implement it, the security team who will be involved in the protocols and the regular monitoring, the employees who will be pushing this technology onto patients and other staff, and then the patients who will be using it. Everybody in that chain, including the AI, should be held accountable for their role in terms of the deployment of an application. If you don't, you end up with bad outputs like we saw in that skin cancer thing, verification failures like we just saw in that employee who allowed the malware to attack their password usage, unauthorized access, and this ultimately harms people. If you consider in the coming years the amount of autonomous surgical robots that are going to be used, recently there was a fully robotic heart surgery that was done very successfully. Now, as that robot is trained on practicing sessions with the assistance or the co-piloting of human doctors, eventually it will have the training that it needs to run autonomously. And in which case we'll be going into a system, into a very utopic Star Trek-like system and saying, I need this surgery done, and the robot will just automatically very quickly do this. There's a great benefit in that. There's less risk of human error. There's less risk of harming other organs or causing secondary damage. There are a lot of benefits to it, but the risk is if there's no clear accountability pathway, that there would be a lack in the quality of the procedure. So in 2018, there was Uber in Arizona using autonomous cars. A lot of people have gotten into these self-driving cars, and the car itself struck a pedestrian. And if you look at that example, Uber had a civil lawsuit, but it was autonomous and there was no human oversight. There was no driver to say there's a person, hit the brake. And in the case of healthcare, if we end up with autonomous robots doing surgery, there should still be human oversight and someone to say, hit the brake. And that should be implemented in those incident response security protocols and system backups. That's the end of our presentation. The idea is stay vigilant, stay up to date with research, update your software and your hardware, and ensure that everybody is trained in what the risks are and how to mitigate them.
Excellent.
Any questions?
Yeah, I mean, where does one begin in being responsible? Where does one begin in even seeking counsel for some of these things? as you said, all these mishaps were done from well-intended individuals who have deep knowledge in their respective technical areas. But how does one know what someone doesn't simply know?
The first thing is not to get excited by the hype. So just because there's a new AI skin testing app doesn't mean that you should instantly adopt it. Just because 10 other famous hospitals adopted it doesn't mean that you should. There should be a layer of discrepancy or of discernment where your own team does its own testing. That's why I highlighted ethical hacking. Um, you can also ethically test systems before you implement them. And security teams are now becoming a much more important component of these healthcare bodies. And because you don't know, because you as an administrator know you want new technology, but you know you don't know the security risks. So those security teams are becoming important. Also to do training for the rest of the staff. But ultimately, whatever you don't know and you're relying on, larger systems like Meta and Google have a lot of built-in cyber armor or cyber protection. So that allows you to not think, but even then it's a shared responsibility model. So the cloud service provider can offer a certain layer of protection, and then there's still an onus on you to be able to go and look at it yourself. So ultimately educate yourself on what these risks are and how to avoid them. You can do these security risk assessments like what we're offering at SafeCheck. If you don't know where to start, there are other groups that do similar things. And some companies that are doing them require that you have a security team to use their softwares. Others require that you can, like SafeCheck, anybody can use it. But you must be doing that. You must be running regular assessments to find out what you don't know.
There's some level of difficulty in encouraging that people should learn and expand their understanding of this field. It is rapidly evolving. There is an explosion of innovations every day, as we see. One feature comes out today that didn't exist yesterday, and it has these many implications. Um, how
And
would
with each new feature, there's a new risk.
mhm. How do you recommend somebody to begin doing their due diligence and learning more about these technologies?
Number one, before you engage with a new software in whatever practice, whatever industry you're in, learn what that software is, learn the ins and outs, learn what firewalls are there or what safety methods are there. This is important, especially if you're dealing with any type of sensitive data. So if you're using an app just for fun and there's nothing sensitive about the information going in, sure, you can skip the step. If you are using an app to collect people's personal information, their name, their weight, their age, or any sort of personal identifying information, then the responsibility and that accountability is on you to make sure you know the safety mechanisms of the software that you're using and how it's integrating with your own system. So oftentimes the issue is not only just with a bad actor somewhere in a dark room. There could be an error within a software solution provider's operating system that clashes with yours. And if they fail, then you fail. So you also need continuous monitoring in this case, meaning somebody in your team on your side that's constantly looking out for just that, for any security breaches. Again, this goes back to the research, and you would rely on regulatory bodies for that, the latest bounds and leaps in terms of the research that's out there. But again, that's not in real time. So it's, as you mentioned, if some new feature comes out tomorrow, if there's a new transformer model that everybody's using in AI development, it will take time. There's a latency period between the time that that technology comes out and a regulatory body has made a ruling on it, which is where the onus comes back onto your own company's security or systems engineering team to stay up to date. Education.
It's a bit difficult given the sheer lack of talent. I'm sure you've encountered it just like looking around and pitching your own services, how immature the industry still is. You have to have technical literacy, data literacy, machine learning, AI literacy, and
Quality, legal. And you're right, the talent is less. There is less talent, but that on its own is not a problem. I mean, it is a problem, yes, having a lack of talent. If you own a company, you want to make sure that you have the right staff in-house. You don't have the right staff in-house, so you outsource that talent. If you can't find the outsourced talent, you look for another solution. If you're doing that, you're already 50% better. But if you're not doing that, where I think the bigger problem lies is in corporate bodies um, who feel better than thou. They feel that they're impervious to these attacks. They say it won't happen to us, or this happens only to other people, or we'll be okay. And I've heard this with my own potential customers. We'll be okay. We don't need this layer of protection. Or if it happens, we'll deal with it then because it's a cost we can't incur now. And it's like a chat you and I had recently where we talked about nobody ever thinks they're going to get hurt. No one ever thinks they're going to get sick. You feel pretty well, you feel pretty okay, and suddenly something happens. And then you're going to say, I wish I had been paying that X amount for insurance per year rather than spending this exorbitant hospital bill now. Similar concept. So you almost need to self-insure yourself and protect yourself. That means letting go of the ego that nothing will happen. And that means having very clear guidelines to say this is how we will handle something if something were to happen.
It's cheaper to eat better and exercise than it is to pay for a heart surgery or some other complicated procedure.
Exactly. Preventative, proactive medicine. But even then, you could be the healthiest person, you could be eating very well, and you could slip and you can fall. Um,
Sure.
Anything can happen. So even when you think you've done what the best you can do to protect yourself, you're
True.
not necessarily protected. In AI and machine learning, you're definitely not sure because most people barely understands the back end of how a system is working. They
Yeah.
barely understand the billions of layers of neural networks that are happening and how they communicate with third party billions of layers of networks. So there is nobody who's above it all, and therefore you do need to rely on other systems, which is again why I really suggest internal security risk assessment postures, at least to give you a context within your own operations to say it looks like we're doing okay here, or it looks like we haven't attended to a whole other list of things.
Well, with all that being said, thank you very much,
Thank
Shaista.
you.
It's always a pleasure talking, chatting, learning from you. We're going to take a brief intermission, and then we're going to be back with the next presentation. Um, yeah, thank you very
Thank
much.
you. Thanks. Always. Thank you.